Hello. Today we are going to see how ulcer, a gastric ulcer or peptic ulcer is diagnosed. Everybody knows ulcer is something, a wound-like thing within our intestine or stomach or within our GI tract. How it is diagnosed? See, first is always the patient has to be examined and clinically examined, and history should be taken by the physician. Gastro physician or a surgeon or somebody has to examine the patient and ask history. This is very important. Then those days, everybody knows the barium meal. They were told that they will take some liquid, white color liquid, and they'll take X-ray. These are all now still, though it is in practice, but it is almost obsolete. But the best way or the gold standard or the easy way or the 100% perfect way to diagnose any gastric ulcer or duodenal ulcer is doing an endoscopy. So endoscopy is something like a small tube, almost the size of a little finger, and it goes inside, and we can visually, with your own eyes, we can see where exactly the ulcer or what type of ulcer, how many ulcers, whether the ulcer is bleeding or whether the ulcer can change into any a tumor or cancer. So any biopsy to be taken, and if we look at the ulcer, whether it could be because of the H. pylori infection, whether we need a biopsy for the H. pylori, and all these things can be easily assessed. Not only that, the intestinal movements also be partially assessed by the endoscopy. So endoscopy is the gold standard for ulcer in the from mouth, you can say from mouth, foot pipe, your stomach, and duodenum, up to second part of the duodenum. This is the gold standard, and endoscopy is done as a OP procedure. There is no need for admission. It's a hardly 2 to 3 minutes procedure, and after the procedure you can go to office. So ulcer is diagnosed mainly by the physician asking question, examining, and generally by doing the endoscopy. And if needed, they may ask for further investigations like barium swallow, or even sometimes CT scan, all these things. Thank you.